Let's talk about acne on testosterone replacement therapy because this freaks a lot of guys out when they first start. First thing, don't be surprised if you get some acne early on when starting TRT or after any dose changes. Hormones are shifting, androgen receptors get more stimulation, oil glands ramp up, pores clog easier. Think of it as a mini second puberty. In fact, if you are more prone to acne as a teenager, you might be a little more likely to get it when you start TRT compared to someone who never really had acne. But that's definitely not always the case. Something to understand is that testosterone naturally increases sebum production. That just means your skin gets oilier. A lot of guys with low testosterone actually have pretty dry skin. Once testosterone comes up, the skin produces more oil, which is normal, but that extra oil can clog pores more easily if you're not adjusting your skincare a bit. For most guys, all this levels out in about 3 months once hormone levels stabilize. So before you panic or start throwing medications at it, give your body some time. All of this is usually self-resolving. Now let's clear up some common mistakes I see surrounding testosterone replacement therapy and acne. DHT blockers like finasteride or dutasteride are a bad idea if your goal is acne control. Blocking DHT sounds logical, but in men, sebum production is largely driven by testosterone itself. Things like finasteride usually don't fix acne, and the downside of blocking DHT can include libido issues, mood changes, metabolic effects, and all other kinds of crap you don't want to deal with. Whole separate conversation, but for acne, it's not the move. Same thing with aromatase inhibitors. Blocking estrogen does not fix acne. Acne is androgen driven. Dropping estradiol can actually make skin worse and cause a bunch of other problems you definitely don't want. Don't crash your estrogen trying to fix your skin. Now, if acne after starting TRT is annoying but not severe, here are some reasonable things that might help. Talk with your prescriber before trying any of these. Supplemental zinc, around 30 to 50 milligrams per day. Zinc has anti-inflammatory effects and some antimicrobial activity against acne bacteria. Some patients find that supplementing with zinc can reduce inflammatory lesions. Vitamin B5 or pantothenic acid. Start around 500 milligrams twice per day and titrate up slowly if tolerated, sometimes in the 2 to 3 gram range. The theory is it helps regulate skin oil metabolism through coenzyme A pathways. Evidence is mixed, but some people clearly benefit. Go slow with this though, because too much too soon can cause some GI upset. Vitamin A, around 5,000 to 10,000 international units daily. This gives a mild retinoid-like effect and may reduce sebaceous gland activity and clog pores. Respect dosing with vitamin A. It's a fat-soluble vitamin that accumulates. More is not better. Omega-3 fatty acids, roughly 3 to 4 grams daily. These help reduce inflammation and may improve insulin sensitivity, which indirectly reduces sebum production. Low risk, reasonable upside. Diet matters more than people want to admit. High glycemic foods spike insulin and IGF, which increase androgen signaling in the skin and drive oil production. So cut back on the sweets. Dairy, especially whey-heavy dairy, can do something similar. You don't necessarily have to eliminate them forever, but pulling them back for a few months can help. Topical stuff can help, but understand the limits. They can work well for spot treatment or mild cases, but if acne is widespread or persistent, topicals alone usually aren't a great long-term solution. You'll see things like benzoyl peroxide washes and salicylic acid cleaners recommended by dermatologists, which might be worth a try. Same with oral antibiotics. They often work well initially because they reduce inflammation and bacteria, but acne frequently comes right back when you stop them. As far as everyday cleansing, I've seen a lot of guys have good success using things like sulfur-based soaps or using Head & Shoulders shampoo as a body wash, which can both help by reducing microbial load on the skin. Another lever most people overlook when it comes to testosterone replacement therapy and acne is injection frequency. Smaller, more frequent injections often smooth hormonal fluctuations. There's not great data on it, but clinically I see this help a lot. Talk to your provider before making changes. And here's another practical tip most guys overlook. Synthetic athletic fabrics trap heat, sweat, and cause friction. That can trigger acne mechanically, basically irritation-driven breakouts. Switching to natural fibers like Pima cotton or merino wool can generally reduce irritation. Yeah, they cost more, but they're easier on the skin. Now, if you get past that initial hormone stabilization period, say around 3 months, and acne is still persistent, that's when trying something like isotretinoin or Accutane becomes a reasonable conversation. Taking low-dose isotretinoin, something like 10 milligrams per day, can work extremely well. It's usually much better tolerated than traditional high-dose protocols. Side effects tend to be milder, improvement often starts fairly quickly, and once you reach a cumulative dose, many patients can discontinue it and stay clear of acne long-term. Dermatologist Dr. Stephen Devos talks about this approach a lot. And he's not just a dermatologist, he's also an expert in hormone optimization and testosterone replacement therapy, so uniquely qualified here. That low-dose, longer duration approach he recommends can be a really effective solution if conservative measures don't work. That course might take a year or two to achieve complete resolution, depending upon the dosing and severity of the symptoms, But again, it can be a very effective long-term solution if needed. And many people start to see improvements rapidly with this low-dose approach, even within a few weeks of beginning treatment. Bottom line, some acne early on with TRT treatment is common and usually temporary. Don't crash your hormones trying to fix it. Give your body some time, optimize basics, use reasonable adjuncts, and escalate treatment thoughtfully if it truly persists. And as always, discuss with your prescriber before trying any of this.